How does oligodendroglioma brain tumor grade chain? Imagine a tumor starting out slow and gentle, then over time becoming more aggressive and harder to control. That's often how oligodendrogliomas change their grade. These tumors are classified mainly into two types based on how they look under a microscope and how they behave. The first is called a low-grade tumor, which is less aggressive and grows slowly. The second is a high-grade tumor, which is more aggressive and tends to grow faster. Low-grade oligodendrogliomas are considered less dangerous because they develop gradually over many years. They often look more like normal brain cells, which means they are well differentiated. Because of their slow growth, they might not cause symptoms early on. Sometimes, they are found only after they grow large enough to cause seizures, headaches, or other neurological symptoms. These tumors tend to have a better outlook because they grow slowly and are less likely to spread quickly. High-grade oligodendrogliomas, also called anaplastic oligodendrogliomas, are quite different. They grow faster, and their cells look more abnormal and less like normal brain cells. These tumors show features like increased cell division, which means they are dividing more rapidly. They may also have areas of microvascular proliferation, where new blood vessels form to supply the tumor, or even areas of cell death called necrosis. Because they are more aggressive, high-grade tumors tend to recur more often and have a less favorable outlook. The change from a low-grade to a high-grade tumor is called progression. Over time, a tumor that started as a slow-growing lesion can acquire more abnormal features, become more aggressive, and grow faster. This transformation is a critical factor in treatment planning because it often means a shift to more intensive therapies. The process of grading is determined by a neuropathologist who examines tissue samples taken during surgery or biopsy. They look for specific features and molecular markers, such as mutations in the isocitrate dehydrogenase gene and the presence of a 1p19q code lesion, which are characteristic of oligodendrogliomas. In summary, oligodendrogliomas can change from a less aggressive, slow-growing tumor to a more aggressive, fast-growing one. This change involves the tumor cells becoming more abnormal and dividing more rapidly. Recognizing this progression is important because it influences how doctors approach treatment and what the prognosis might be. Regular monitoring with imaging and pathological assessment helps catch these changes early, allowing for adjustments in management. Always consult with healthcare professionals for personalized advice and treatment options.